Today we will discuss breast cancer. Breast cancer is a type of cancer that originates in the cells of the breast. It can occur in both men and women, but it is much more common in women. Breast cancer starts when cells in the breast begin to grow and multiply out of control, forming a tumor. If left untreated, these cancer cells can spread to other parts of the body, such as the bones, liver, and brain. Types of breast cancer. There are several types of breast cancer, including ductal carcinoma, lobular carcinoma, and inflammatory breast cancer. Ductal carcinoma is the most common type of breast cancer, and it starts in the cells that line the milk ducts in the breast. Lobular carcinoma starts in the lobules, which are the glands that produce milk. Inflammatory breast cancer is a rare and aggressive form of breast cancer that causes swelling and redness in the breast. Stages of breast cancer. Stage 0. Cancer cells are present but have not spread beyond the breast tissue. This stage is also known as non-invasive or in situ breast cancer. Stage I. The cancer is small and has not spread beyond the breast. Stage 2. The cancer is larger or has spread to nearby lymph nodes. Stage 3. The cancer has spread to the lymph nodes in the chest or under the arm, but has not spread to other parts of the body. This stage is also known as locally advanced breast cancer. Stage 4. The cancer has spread to other parts of the body, such as the bones, liver, or brain. This level is likewise referred to as metastatic breast cancer. Grades of breast cancer. Grade 1. Low grade. The cancer cells look similar to normal cells and are growing slowly. This grade is also known as well differentiated. Grade 2. Intermediate grade. The cancer cells look less like normal cells and are growing more quickly. This grade is also known as moderately differentiated. Grade 3. High grade. The cancer cells look very different from normal cells and are growing aggressively. This grade is also known as poorly differentiated. Causes of breast cancer. The exact causes of breast cancer are not fully understood, but there are several factors that may increase a person's risk of developing the disease. Some of these risk factors include: being a woman. Breast cancer is much more common in women than in men. Age. The risk of breast cancer increases as a person gets older. Family history. People with a family history of breast cancer, especially a mother, sister, or daughter, have a higher risk of developing the disease. Personal history of breast cancer. People who have had breast cancer before have a higher risk of developing it again. Certain genetic mutations. Certain inherited genetic mutations, such as mutations in the BRCA1 or BRCA2 genes, increase the risk of breast cancer. Hormonal factors. Symptoms of breast cancer. The most common symptom of breast cancer is a new lump or mass in the breast or underarm. Other symptoms of breast cancer may include changes in the size or shape of the breast, changes in the skin of the breast, such as redness or dimpling, nipple discharge or turning inward of the nipple, swelling in the breast, armpit, or collarbone area, persistent pain in the breast or armpit. Diagnosis of breast cancer. There are several tests that may be used to diagnose breast cancer, including physical exam. A healthcare provider will examine the breasts and underarms for lumps, swelling, or other abnormalities. To perform a self-exam, start by standing in front of a mirror and looking at your breasts for any changes in size, shape, or appearance, such as dimpling, swelling, or redness. Next, feel your breasts for any lumps or abnormalities, using a circular motion with the pads of your fingers. It is important to cover the entire breast, including the armpit and up to the collarbone. Mammogram. This is an X-ray of the breasts that can help to identify abnormalities that may not be detectable by a physical exam. Ultrasound. This test uses sound waves to create a picture of the inside of the breast. It may be used to further evaluate an area of concern seen on a mammogram. A biopsy is a procedure in which a small sample of breast tissue is removed and examined under a microscope to determine if it is cancerous. There are several types of biopsies that may be used to diagnose breast cancer, including fine needle aspiration biopsy, core needle biopsy, and surgical biopsy. Additional testing. If breast cancer is diagnosed, additional testing may be done to determine the stage of cancer and the best treatment options. This may include imaging tests such as a CT scan or PET scan, as well as blood tests and other procedures. It is important to note that a diagnosis of breast cancer can be a difficult and stressful experience. Treatment of breast cancer. The treatment of breast cancer will depend on a variety of factors, including the type of breast cancer, the stage of cancer, and the individual's overall health. Some common treatments for breast cancer include surgery. Surgery is often the first line of treatment for breast cancer. There are several types of surgery that may be used to treat breast cancer, including lumpectomy. This procedure removes the cancerous tumor and a small margin of healthy tissue around it. Mastectomy. This procedure removes the entire breast. There are several types of mastectomy, including partial mastectomy, total mastectomy, and radical mastectomy. Sentinel lymph node biopsy. This procedure involves removing the lymph nodes closest to the breast to determine if the cancer has spread. Chemotherapy. This treatment uses drugs to kill cancer cells. Chemotherapy may be given before surgery to shrink the tumor, after surgery to kill any remaining cancer cells, or as the primary treatment for advanced cancer. Radiation therapy. This treatment uses high-energy beams, such as X-rays, to kill cancer cells. It may be given before or after surgery, or as the primary treatment for advanced cancer. Hormone therapy. Some breast cancers, such as those that are estrogen receptor positive, may be treated with hormone therapy drugs that block the effects of estrogen in the body. Targeted therapy. These are drugs that target specific abnormalities in cancer cells. They may be used in combination with chemotherapy or other treatments. It is important to work with a healthcare team to determine the best treatment plan for an individual's specific situation. Treatment decisions will depend on the type and stage of the cancer, as well as the individual's overall health and personal preferences. Breast cancer prevention. There are several steps that you can take to reduce your risk of developing breast cancer. Maintain a healthy weight. Being overweight or obese can increase your risk of breast cancer. Try to maintain a healthy weight through a combination of diet and exercise. Limit alcohol consumption. Drinking alcohol can increase your risk of breast cancer. If you do drink alcohol, limit your intake to no more than 1 drink per day. Don't smoke. Smoking tobacco can increase your risk of breast cancer and many other types of cancer. If you smoke, quitting is the single most important thing you can do to reduce your risk of cancer. Get regular exercise. Aim for as a minimum of 150 mins of moderate depth workout or 75 mins of vigorous depth workout in keeping with the week. Eat a healthy diet, a diet that is high in fruits, vegetables, and whole grains and low in processed and red meats may help reduce your risk of breast cancer. Limit your exposure to environmental toxins. Avoiding exposure to environmental toxins, such as certain chemicals and radiation, can help reduce your risk of breast cancer. Consider taking medications to reduce your risk. Some women may be able to reduce their risk of breast cancer by taking certain medications, such as tamoxifen or raloxifene. Talk to your doctor about whether these medications may be appropriate for you. Disclaimer. The materials and information contained on the Zeal Nutri channel are provided for educational and general purposes only and therefore are no substitute for informed medical advice or care. Please consult a medical doctor to seek treatment for any illnesses or medical concerns you may have. Thanks for listening. A like is always appreciated, and remember to subscribe for more health-related videos.